Good afternoon, everyone. Have some more people join here. Good afternoon, Deb, Victoria, Jonathan. Thanks for joining, guys. We are live in San Antonio, Texas. We're here with Dr. Jeneby, also known as Dr. Boom Boom Pow. We are doing the second case of the day. She's doing a breast augmentation and breast lift. This is a very common procedure, pretty simple. So she's going 350 on her left side and 400 cc's on her right. Very common to do different size implants. The majority of women have uneven breasts, whether it's a significant difference or it's a small difference. That's one of the great things about implants, is not only does it give you that extra volume that you may be looking for, it can also even them out. So two benefits there to breast augmentations. The breast lift, of course, as you age or you have children, breastfeed, all that stuff, your breasts will start to sag. So the breast lift will bring them up, get them perky again, make you look fantastic. If you guys have any questions about breast augmentations and breast lifts, feel free to ask, or anything else. We do all kinds of procedures here: tummy tucks, mommy makeovers, super mommy makeovers, BBLs, arm lifts, back lifts, all the stuff, face stuff, rhinoplasties. If you have anything you're interested in learning more about, please feel free to ask on here. Either myself, if I don't know, I can ask some of our medical professionals in the room, Dr. Jeneby and others. And if you have any questions about our specials, how to book a consultation, we offer a ton of financing options here too. You can ask me directly on the chat, or you can click in the bottom left corner. It says get a quote, fill that information out, and after the live, I will send your information to our team members upstairs who can talk to you more about scheduling and any details you want to know about financing and prices. We are also showing this one on YouTube. If you guys want to go to the link in our bio, it's about 5 or 6 down on our link tree. You can go to the YouTube channel through there, or if you want to go directly to YouTube, you can search at Dr. Jeneby Plastic Surgery. On YouTube, the camera is flipped, so you can see the surgery going on. You can see Dr. Jeneby operating. You can see him doing the breast augmentation, the breast lift that we're doing right now, versus on TikTok, you can just see my face for answering questions.
John, we're going to be done here in a minute.
We have October coming to an end, so we do have our specials finishing up for October. Our October specials, we have breast augmentations and breast lifts on special for $1,500 off. We have tummy tucks for $2,500 off, as well as our consultations are $150 off. With our consultations, the fee that you pay for the consultation, if you book with our surgeons, it does go towards the cost of your surgery. And then last but not least, we are offering a liposuction special until tomorrow at 11:59 p.m. That will be any liposuction package you buy. You also get skin tightening added onto that. So we have Renuvion when you lose weight naturally, or you lose weight through diet, through the GLP-1, or anything or through liposuction. You'll get that extra skin after significant weight loss. So that skin tightening package will help. You'll get the fat out with the lipo, right? And then you'll get the skin tightened up with the Renuvion. Next month, so on Saturday, we have brand new specials coming out. If you're ever looking for our specials, you can go to the pin. It's pinned to the top of our profiles. Or you can also contact us directly, and our sales team sometimes has extra promotions going on as well, so you can always be sure to ask about those. Out of breath now.
Probably went to work though, because I went to want to name our kid Kobe.
Kobe.
Sorry.
Kobe with a K-O-B-E. Like the basketball player.
I know.
Oh, I thought you said
I
Cody.
went to want to name my kid Kobe, so that's
I've
probably
always-
good we didn't have a kid together.
I've always wanted to, if I had a son, Matt.
If it was a boy too, I would have been like, Arturo, dude, what are you talking about?
Oh my gosh.
Gotta have a junior. But my next one's a girl. Artura.
Does she have a name yet?
No.
No?
Oh, that's a whole other
Oh no.
fun time. That's actually not bad. We just don't agree on anything.
So it is bad. Good afternoon, Amy, Jackson, Ed.
We agreed on one, kind of.
What's sublocade? Sublocade?
Hi, protocols for people on. What about protocols? We don't use Sublocade here.
Tracy, Alice, thanks for joining. Lisa, she said, duh. Oh, let me explain. Okay.
We use Marcaine. I mean, it's the same thing as sublimate.
I don't know what's gonna be natural.
Huh?
I don't know what's gonna happen with that.
That's fine. I'll answer it. No, I haven't heard house in a while.
I just started listening to music in my car. I didn't realize I haven't been listening to it.
Yeah, I haven't been listening to it in a while.
I think it's because I was so tuned out my brain, right? But I started listening to it again the past like few days, and now it just automatically does it when I get in the car.
My question is, what is your Sublocade? What should the anesthesia protocol be? Is it POS?
I don't know what that means. Possible. Oh, what if you're on Sublocade? What would the anesthesia protocol be? Dr. Hernandez, if you're on Sublocade, what should the anesthesia protocol be? Is it possible?
What is the medication again?
Sublocade?
That's Bubocaine or Marcaine.
Maybe it's Suboxone.
Yeah, are you thinking of Suboxone?
Maybe Suboxone. And maybe that's a trade name for it.
Sublocade is a trade name for Marcaine.
I'm waiting for her to respond.
Yeah. Oh, extended. Sublocade is extended release once monthly injection of Marcaine.
Uh-huh.
Well,
Yeah, that's what we just asked them.
there are always going to be interactions with the medications and narcotics that I administer if they're chronically on their own protocol. So
How long would you recommend they stop beforehand? No?
they can't stop.
Yeah.
They're under care of another physician. They need to be, they're probably under the evaluation of a pain specialist already.
Oh, I'm thinking of another drug. I was way off.
they have to-
I was thinking of something else. Sorry.
Their pain guy has to know what's going on, basically.
So
Yeah.
okay, the protocol has to be adjusted. Whoever your
Pain management.
pain management doctor is at the moment, we need to discuss that with them and kind of go back and forth to make sure, because something we do is we make sure that you guys are safe. That is our number one priority, is making sure you're safe, making sure you're a good candidate to be under anesthesia. So I hate how the filter's showing over the, I think the filter's showing over the mask. So yes, it is possible we would need to have a discussion with your pain medication doctor, because they will. I don't know if they'll counteract or exactly what will happen, but they will react together.
It's me. I was gonna say, you're the best nurse ever. Thanks, Art.
Screenshot it, post it.
Take pictures of us at the game. Yeah, took pictures of himself, like 5 of them.
Who did?
Some dude.
I would have done the same
They took
thing.
a picture with the stadium behind us, the 5 of us.
And he had it on
He
him?
was like, but we didn't know what he was doing until I got my phone back.
Did he take pictures of you too?
Yes, he did.
Okay.
But he wanted to mess with us.
Okay.
I would have done the same thing, actually, to be honest
That
with
sounds like an art move.
you. You're welcome. You're welcome for the pictures.
But he was like, "Wrong."
She's asking what will react together.
Man, she's.
You'd have to come in. Yeah, you definitely have to come in for more.
Oh man,
Well, not to get too
it's a little technical.
specific, but I use a lot of short-term narcotics.
Okay. He used a lot of short-term narcotics,
Those are very long.
and because those are long-term, I'm just repeating what he's saying.
Interact with both of them, you get not the normal kind of reaction,
Okay.
acute effect, hyperesthesia. It's just, you never know how they're going to react.
Okay.
It's very.
So you said because they're working together, you never know how they're gonna react together in your body. So, okay, so yeah, so he said because what he uses is short term and what you're using is long term, the way that they would combine together, they would react in a way that he's not sure of. They can always be different, so it's something that would need to be evaluated further. We do virtual consults too, and that's a good question to ask.
The number one thing is, how is your pain doctor gonna manage your pain? We don't be taking
Okay,
any pain.
Dr. Jason,
And they have to
how would the
agree,
pain doctor
your pain doctor
manage your
will
pain
manage
after that?
And then
So we're not saying no, we're saying there definitely are further questions to ask and further research to do on it. So I would say,
Definitely give us a call.
yeah, or do a virtual consult or talk to our patient coordinators and they can ask the right questions and, you know, ask for blood work or anything that they need to know to do that. Yes, absolutely. Sorry, it's not like an exact answer, just he's saying everything can react differently. We would need to know more details.
definitely your pain doctor will have to know what you're doing.
Yeah, so your pain doctor would need to be aware of what was happening, what was being administered to you here, all that. Sorry.
It's a hard case, doc. Antagonist, antagonist.
She's gonna have much bigger breasts because she already has a lot of tissue. She said, "Go big or go home." Of course, yes. I wish I could give you the exact answer, like I said, but it's safest for you and for us to know more detail to give the correct response on what you're needing. If you just do the consultation or come in and visit us. And then, of course, have your pain doctor in the loop as well.
I gotta know exactly for that.
Question: what, in the doctor's opinion, does he recommend? Does he recommend a faja for swelling?
We always like fajas for swelling.
So yes, we always like fajas for swelling. We will give you one here if you're doing like a mommy makeover or anything that you're needing a faja for. But yes, we can provide one or
One out.
but we prefer that we give you the one we have because we know it works. So you're usually kept overnight for tummy tucks. If you have anything with drains, typically you're kept overnight. And they will see you in the morning. Just had a lift and implants 525 cc's. Is armpit pain normal? When I breathe in, it hurts. How
We don't
soon?
do that. You would probably have to call your doctor. If you were not our patient, we probably wouldn't
Were you a
give
patient here?
We don't do armpits
No, she said she has armpit pain
from a procedure. We
from.
don't do it.
Was it here at our location? Did they make the incision through the armpit? Is that why?
Yes.
No, sorry. She's asking me questions.
Oh, okay. If she's had an armpit delivered implant, we don't do that here.
Okay, she said it wasn't. Yeah, was it here with us?
Yeah, so we don't really give a lot of advice. But
Right.
everything is okay just by social media. You're not in front of us, you're not our patient.
To the other person asking about the tummy tuck, yes, correct. You were kept overnight.
Give general advice
Okay.
on
Yeah, Dr. J's saying we can give you general advice, but because you're under patient, we can't give exact advice.
If anything is
Your
normal.
surgery was 2 days ago, so you're going to experience pain in areas you might not realize. Like I mentioned earlier on an earlier
Call
live,
your physician.
he would recommend you call your physician, but there's going to be pain in areas surrounding that. But you're very, very fresh out of surgery, so. She only had her surgery 2 days ago, so.
Yeah, that's something you need to ask your doctor.
Yeah, there you go. Just double check with your doctor. There should be someone that your patient coordinator, you should be able to text, or nurse that you should be able to text and ask. Because we don't want to give you the wrong information and then there's like something going on there.
No, can't see you. Not our place.
Thank you, Jeffrey. We appreciate that. Tomorrow's Halloween.
Good.
Really nothing. Okay, getting a what is it called? Pennilectomy? Muscle repair and belly button replacement after major weight loss on December 10th. Any tips? Just be ready for recovery. Just prepare, give yourself lots of protein before, and make sure you're on your, take off your any vitamins, medications that they recommend getting off of, and then getting ready for recovery. There's definitely gonna be some soreness, some tenderness there. Making sure you have a good caregiver to help you, because a lot of people will say they'll take good care of you and then you end up doing more care yourself. So make sure you have a very trusted caregiver, someone very responsible.
Can we get another stapler? Arturo?
Alright, they need another stapler? Another stapler, yeah.
Okay, Art. Can you give us like 3 or 4 staples for Dr. Hernandez, please? So he can fill it up.
Thank you for the questions, guys. I'm happy to help answer them. No, we had a few, but we answered them. Or just so you know, if you're not on YouTube, we have our implants in already. We're working on the first part of the mastopexy, making sure they're gonna how they're gonna look when they're lifted and how they're gonna sit here. So they sit her up and take a look. On YouTube you can see this, but on TikTok unfortunately you can't. Activity. Oh, does doctor recommend lymphatic massage after surgery, and when can a patient expect to be back to normal activities? Yes, we do recommend lymphatic massage. We have a machine here across the street that can help with the lymphatic massage. I believe, I'll wait for him to be done. I believe you do that 3 to 4 weeks after surgery. Let me just double check. You use the Pro Balancer 3 to 4 weeks after?
We started 3 to 4 weeks because it hurts.
Okay. So we started 3 to 4 weeks.
Too early, it is really painful.
If you do it too early, it's painful. So 3 to 4 weeks after, we have a machine that does it, or you can do lymphatic massage. And then normal activity you can expect, just depending on what surgery you have done, 6 to 8 weeks. I mean, you're still going to have some tenderness, especially if you're having a bigger procedure done, like a tummy tuck or liposuction, so it's me a little bit sore. Anything with drains. Breast augmentation you can expect 6 weeks you'll be back to normal. You will still have some tenderness though. You don't realize how much you use your chest muscle until you have something placed in there. Like I mentioned earlier, turning a doorknob or flushing the toilet, you know, that little bit still will use your chest muscle. So that's probably the hardest part after, but you can expect from 6 to 8 weeks to be pretty much back to normal, just a little soreness. Is it the same for fleur-de-lis? Probably more on the side of the 8-week mark. We do ab etching on males and females. We do lipo, but a lot of our men come in and request basically the equivalent of a mommy makeover. They do that we call the Sparta surgery, which is going to be liposuction and ab etching, the HD lipo, all that stuff. We have some, we have a recent one of a female that we have on our, and we have some males on our Instagram on our before and afters. We have some of the ab etching patients. Yes, of course, no problem. Glad to help. Thank you for the follow, Bobby. That's funny. Too bad we only we do plastic surgery here, so if you're sick, you're gonna have to go somewhere else. Robbing your attention. I don't know what your name. Robbing your attention. Does J plasma burn bad afterwards, and for how long? I don't know. Let me ask. Let me ask that question, Banks.
Almost every surgeon. That works with every surgeon. You understand? That's on you. That's not on us. All this, we gotta look at the future. You gotta.
Does J plasma burn bad afterwards, and for how long?
You have to do that.
Oh, I'll wait. He's talking to the assistant. Let me borrow the lipo machine. Yeah. Everyone loves a good lipo. Dr. Hernandez, who's this song by? Ian Asher? Thank you. Thank you for the follow, Joy. I'm still waiting on your J plasma question. They're just doing something right now. I don't want to distract them. So Dr. Jeneby, robbing your attention. Dr. Jeneby likes house music. He likes to listen to, I think it's Joe City, he says, and some oldies sometimes, but mostly he listens to house. Dr. Phillips is known for listening to Journey Radio. Dr. Barlow listens to a mix of country, Christian, oldies, like oldies rock kind of. I'm not sure about Dr. Hires. But yes, I like working with Dr. Jeneby here because I'm a house music person too. Yeah, I mean, I'm trying to think. I know that Dr. Barr listens to, like, the Eagles and stuff. I haven't heard any of them listen to death metal yet. Maybe.
Don't put that together. You're not figuring it out. Oh, you want to hold it?
I'm just predicting this. I'm going very deep.
Okay, so yeah. See, I'm taking all this out.
Doc, we have a question. Does J plasma burn bad afterwards, and for how long?
It doesn't really burn bad. I mean, I guess there's some discomfort, but we don't have a lot of people saying there's burning.
Okay. Some discomfort, but no one's really come and said it's burning.
From the lipo.
The discomfort's from the lipo.
Yeah. Lipo hurts more than J plasma.
He says the liposuction hurts worse than the J plasma.
Minus about 150 from the left side.
Oh, listen, it's Dom Dalla.
Ashley's friend.
I know, I told her he's coming to Austin tomorrow. He's doing 2 concerts tomorrow.
She wanted to go, she could have gone. I would have watched Mad Max.
She says that between that and the Dia de los Muertos party.
What?
She said you're having a party or something, or she's going to a party on Saturday. Something on Saturday. Tomorrow's Halloween, that's why she's gonna go trick-or-treating and stuff. Yes, it can be. I mean, it's definitely, it's worth it, right? But it's, you can, I mean, you're gonna be sore. You're gonna have some tenderness, and we're going, depending on what you're having done, we're either going underneath the muscle or we're, you know, poking around, getting all the fat out. So you're gonna have some sensitivity, some soreness, some bruising. You know, where the incisions are, that's gonna be a little sore too. A lot of recovery, but you know, confidence is what we're going after here. So confidence is captivating, he said.
I got Shutterstock.
I know.
I don't know how much we get a month. I've been paying $30 a month for a long time. So
Okay, it's
we should
probably,
have a lot of credits.
oh yeah, if they roll over, yeah, absolutely, they should. Yeah, I used to have Adobe stock, and it would give me, it was $280 a month for 50 pictures. I was like, this is crazy. Crack my back. Sorry about that. Hi Kevin, hi John, Mama Gibbs, hello guys, thanks for joining. For those of you just joining us, we are live in San Antonio, Texas. We're here with Dr. Jeneby on the second case of the day. She's doing a pretty quick and easy procedure here. She's doing just a breast augmentation with a breast lift. So she's going 350 cc's on one side and 450, excuse me, on the other. And then she's doing the lift. So we already got the implants in. That's already good to go. Now we're working on the lift portion of her procedure. And yeah, so if we're here, if you guys have any questions, want to know anything about surgeries, procedures we offer, pricing, financing, specials we have, feel free to ask. Or if you're wanting to book a consultation or get a direct quote, you can hit that bottom left corner to get a quote button. You fill that out, and I can send your information to the team members upstairs, and they will get in contact with you. We do offer both in-person and virtual consultations. Whether you're in town or out of town, we can do virtual. Sometimes it's just way more convenient that way. So be sure to check that out in the link in our bio as well. And last but not least, we are showing this on YouTube. So if you're interested in watching the lift, the breast lift going on, you can hop over to our YouTube channel. We have it on our link tree and the link in our bio, or you can go to YouTube and search the @ symbol, Dr. Jeneby Plastic Surgery, and you can see it there. Hi, Colston. Dr. Miami. What about Dr. Miami? Is somebody hopping over to YouTube?
Did you hit cover?
No.
It's right there.
Oh man, what a beautiful shot.
Incoming. The YouTube is, it's the @ symbol, and then Dr. Jeneby Plastic Surgery. It's easier, Tiara, if you go to the link in our bio, the YouTube channel is on there too, if that's easier for you. Oof, I don't even know if I can say that name. Menmeniscus. Memeneski's. It's a doctor. Where are they located? It says it's Men Neski's or Eskies, Florida. I haven't heard of them before. Am I saying it right too? I'm all sounded out.
Yeah, that's like no kids, right?
Yeah. It's like my kid's pediatrician. It's a really long Greek name, so I just call him Dr. L. I don't know if he lets people call him that, but that's what I tell the kids. Dr. Algerd Mam. Well, now it's spelled different. Mamaneskis.
What do they want us
Mamaneskis.
to say about it?
I don't know. If I've heard of them, maybe? I don't know.
No, you haven't. You're on Dr. Genevy's site. You generally don't talk about other plastic surgeons. They don't know it.
Mm-hmm.
150 from the right.
Oops.
A lot of people let the doc say, hey man, you're on my TikTok. Real quick. I'm like, really? All right.
Mm-hmm. Well, I've heard people on the phone. I see his TikToks. I want to go with him.
Isn't that amazing?
It's funny, yeah.
I worked 25 years only to be popular on TikTok. 25 years, man.
Tiara, did you find the YouTube channel okay?
Gotta have a little bit. I guess with BPs, everything's good for the last one, doc, right?
Yeah, everything.
Flush?
The answers has been very, very well.
Yeah, all right. Even 100 cc's, huh? Blood has just got such
Good.
a-
I'm glad you found it.
What is that?
See how it's way different? You can see the actual surgery. Just on TikTok, we get on here because we have a lot of people who engage and ask questions. But it's sad because we can't show the surgery. So it's always just us. We used to show the doctor's face, but then sometimes we get flagged if there's like blood or anything. So we just kept it on us to answer questions. Yes, I remember I talked to you the other day, Brenda. You were on here on Tuesday, I think. Monday or Tuesday. Yeah, he does great work. They all are great. Dr. J's great at body and face. The other doctor's more...
And nose.
Well, yeah, and nose on the face. Dr. Barlow does a lot of... He does that great body work too, but he does huge like weight loss patients. He's really great at those. Dr. Phillips is good at body work. He does a lot of breast augmentations. Yeah. But yes, he does great work. That's what she said. That's why she's going with you.
Syntheron, right? It just...
I'm sorry. Did you ask a question?
Is built.
Let me see. I don't have your name on here. It just says user.
Cintura?
Did you ask a question? I'm looking. I see your question
So
marks.
then how do you say when you're shooting...
It might have filtered out your question. If you want to ask again, I'll try to answer it. I'm not trying to ignore you. I just don't see another question by you.
Huh. Well, well, well. I learned,
Learn something every day.
I learned something again. Los cinturón, los músculos.
Los músculos. Músculo, but
Okay.
you know in Spain, culo is like butt. Little.
Yes, it's me again. I like watching how it does everything that's called. Yes, I know. That doesn't bother me at all because I enjoy it. I like watching it. But it's way, way different on YouTube than it is on TikTok for sure. I forget isn't your surgery's coming up, right? In like 2 weeks or something? Brenda?
Good, finish.
Or maybe next week?
Oh, Doc, my phone.
I know. I'm not even close to it. Here, I think it's. I'm gonna set it laying down because I think it's vibrating off. Oh yes, congratulations! That's so exciting. So we will see you next week then. Which day is it? Are you coming on? Maybe you'll let us do a little video beforehand so we can follow your journey, Brenda. That would be really cool. I'm sorry, so user, it says user 6658 and a bunch of other numbers. I can't see your question. All I see is your question marks. I try to answer everyone on here. So if you, sometimes it filters it. If you want to ask again, I'm happy to answer. I just don't see, I've scrolled through a bunch of them. I don't see. Are you talking about the fleur-de-lis? Because I had said yes, also the 6 to 8 weeks. Because I answered that one a while back. Thursday, I have a following. Oh, nice! That would be so exciting. Yeah. So Brenda, on Facebook, we cannot show blood either. But if you want, we can provide the YouTube link for your Facebook followers to go to. She has a following on Facebook, and she goes live 3 days a week. She's surgery with you next week. So that would be cool, and that would be really nice to do. Like if we can do some videos with you, and then you come in for your post-op visits. We can do journey. You can take some selfies and stuff at home, and we can make like a little video for you. So for those of you just joining us in here, we are live in San Antonio, Texas here with Dr. Jeneby. We are doing our second case of the day. The first one was a real, she had a lot of different procedures that we were doing. We did her arms, we did her lipo on the lipo 360, the front and the back, fat transfer, BBL. We did breast augmentation, breast lift. She had quite a bit done. Now this one's the second case of the day. She is more a simple version of that. She's just doing the breast augmentation and mastopexy, so the breast lift. We've already done the implants. We're working on the lift right now. If you want to see it going on, you can go to our YouTube channel through the link in our bio and check out the YouTube channel where the camera is flipped on the surgery. And if you have any questions for me, whether it's how to book a consultation, pricing, financing options, what else, specials, getting ready for surgery, recovering from surgery, I'm happy to help answer them. Unfortunately, we can't show it on TikTok, the other side, just me, so I'm here to answer questions while it's going on.
Yes? Then you're gonna watch him do the north, the east. We have a lot of people on YouTube or no?
We have Brenda on YouTube.
Yeah, we're gonna start closing up, so we'll have to close the YouTube, but we'll still be on answering questions.
Okay, so let me answer this last question for her. Yeah, I have to give him a heads up. Cool. I will find you're on Thursday, so I'll find your information. I'll send you a text, and then we can chat from there.
Southeast.
All right.